Hey everyone, my name is Mario, and today we're going to be focusing on our primary care teams. We're going to be talking to some of our providers and taking a deeper dive on their journey and what got them here to Gila River Healthcare. And then finally, we're going to talk about the importance of having a primary care provider and what does that benefit to you. So come with me as we learn more about the department today.
Hi everyone, I'm Dr. Wilkinson, Sung Wilkinson. I've been with Gila River Healthcare for 12 years and love this place.
Dr. Wilkinson, can you give us an overview of primary care and maybe some of the locations?
So at Gila River Healthcare, we have 4 locations. The main location is here in Saskatoon, District 3, and Auction, Red Tail Hawk, and Comont. So in Saskatoon, we have the walk-in clinic, which is the same-day outpatient care clinic, the primary care department. We have pediatric, we have family medicine, we have internal medicine, those 3 departments. We do have staff, besides physician and providers. We do have RNs, care coordinators, MAs. Those are intricate personnel that support the department in every aspect for patient care. Internal medicine mostly deal with adults 18 and up, where family medicine we see patient from newborn all the way to 99 years old.
So Dr. Wilkinson, I know we have a walk-in clinic here at HHK and it's very popular, but maybe can you touch a little bit on why it's important and how does it benefit the patient to see their primary care provider?
The structure and the function is different. The structure of the walk-in clinic is the same-day visit, mostly focus on what your needs for today, right now. For example, if a patient couldn't get in to see their primary care doctor, they need medication refill, they can go to the walk-in, and then the walk-in physician or provider would set them up to follow up with their primary care doctor. The primary care doctor is the one that's everything flows into. Your overall health, your preventive care, your referral, the patient's referral, follow through with the primary care doctor. So the goal is to provide an urgent need for certain things like injury, a minor injury that doesn't need to go to the emergency room can go into the walk-in. Something that can be taken care of the same day. For everything else, they should go back to their primary care doctor because the primary care doctor is the one that looked overall everything to make sure that their overall health care is comprehensive. And we can refer out to other specialty too if we need to.
Great. So it sounds like it really benefits the patient.
Absolutely. Comprehensive care that all patients should have a primary care doctor. The primary care doctor is the end point and the beginning for everything else also.
It's like a circle.
A circle. Yep. It goes back to the primary care doctor.
Dr. Wilkinson, you're an MD or a medical doctor. What kind of training or education background did you need to get that?
Sure. First of all, you have to go to college, get your 4 years degree, take your MCAT, get into medical school, 4 years of medical school, which include lectures and clinical training. And then after that, you have to pass your USMLE Step 1 and 2 before you get applying to residency. And in residency, that's another 3 years of training. Now, it's all depend. With family medicine and internal medicine, I believe, are 3 years primary care training. And then you have to pass your Step 3 exam and then your national board. So that's about 11, 12 years.
Wow.
So it depend, yeah.
Great.
So the training is tough, especially residency.
Gotcha.
Yeah.
Dr. Wilkinson, can you talk a little bit about your journey and how you got to Gila River Healthcare and maybe a little bit about how your experience has been?
I find that Gila River provide excellent care. The resources amazing. The community is supportive with the hospital. And it's all about caring for patients, caring for people. I find the culture is very interesting. I learned so much through my orientation about the Native American. And I find that it's very close to what I grew up in my own culture. Here, it's about the people. Here's how we connect with the patient. It's more than just the disease. It's a relationship. We build relationship, we build community, and that's what I feel providers, physician that stays here, sees that, and it provides a good quality of life for my family, for me, and it's one place that I really enjoy, and that's why I've been here for so long. Love it.
Great.
Hey, Mario.
Hey, Dr. Lumkin, good to see you.
Good to see you too.
How are you doing?
I'm
great.
well. How about
I'm
yourself?
Great. We're good. We're good. You know, it's been great, like learning about the primary care team and the providers specifically. And I was wondering if you can actually introduce yourself to the team.
Hi, my name is Dr. Monica Lumkin, and I've been a primary care provider here at Gila River Healthcare Corporation for 20 plus years. My specialty is family practice.
Well, Dr. Lumkin, good to see you again.
Yes.
You know, I want to ask, when our patients come for their primary care visit, like, what is your process?
Yes, so if it's a patient that I don't know, I first introduce myself and I ask the patient what they would like to get out of the visit, and we review their medical history. I perform an examination, and then we come up with a mutually agreeable treatment plan. If it's a patient that I know very well, then we initially catch up, and so we'll spend part of our visit talking and also reviewing the treatment plan and performing a physical exam.
So Dr. Lumkin, you mentioned communication, and I know that's really important for all of our patients. You working here in the community, how has that impacted your practice?
So medicine is medicine everywhere that you practice. However, you have to be aware of the community and the culture where you're practicing. And so I've just learned over the years more and more about the culture, and that's positively impacted the way that I treat my patients. So I've enjoyed learning about the Gila River Indian culture, the food, the people, the customs. So that has been, it's been wonderful that the community has shared that with me.
So Dr. Lumkin, when you're working with our patients, when is it the appropriate time to maybe refer them out?
Yes, when a patient presents with a problem that is outside of our area of expertise here, or if it's a condition that involves services that we don't have here, then we're going to enlist the help of a specialist that are specialist partners in the community. So we will send the patient for a consultation and probable treatment with that specialist. But we do want them to come back to see us so that we can follow up and continue to make sure that they're getting 360 care.
So Dr. Lumkin, do you mind sharing what have been some of your more memorable experiences working with the community?
One experience that I can share is that there was a child that I took care of when I first started working here, and she is now grown up and works in our department, and it's just been wonderful to build these kind of relationships over the years.
Well, Dr. Lumkin, thank you for your time and sharing your stories. We appreciate it. Have a good day.
Absolutely. Thanks for visiting me.
Thanks for having me. My name is Dr. Roger Vialba. I've been with GRHC since 2002, but permanently since 2009.
Well, Dr. Vialba, maybe we can start by talking about how Red Tail Hawk has been. Obviously, we were the alternative care site for a little bit, and I know we reopened in the summer of 2021.
Yeah, we opened up in last summer, 2021, on June 21st, and since then, it's been really good. Our census has been slowly increasing. I think word of mouth is getting out there. One, that we're a safe place to be, and two, that we're open. I think just things take time, because we're definitely seeing an increase in patients from the urban side as well as the community side. So it's been really slow going, but it's been good. It's been slowly increasing with every day, every week.
Well, Dr. Vialba, I know that one of our big challenges is recruiting providers. Maybe do you mind telling us about your journey and how did you get to Gila River Healthcare?
So I was doing a residency out in New York. I can say this, around the turn of the century. And after residency was over, I had also applied for a locum tenens position. And this place actually was the first place that they offered me, and coming out of residency, I said, sure, why not? I'd never been to Arizona. Never been on an Indian reservation either, so I thought it'd be an exciting challenge. My first stop was actually Gila Crossing. And so I was there with Dr. Lumkin and Dr. Song-Nichols and Dr. Wagner.
Dr. Vialba, in your time working here in the community, maybe can you touch on some things that you have grown to appreciate?
Sure. What I like telling providers who might be new, like we've got a locums here now, or per diems who might not be familiar with Gila River, is it usually takes a little while to establish with the patients here, with the community members here. But when they start to know you and appreciate you, they don't want to let you go. So it's actually a wonderful sense of family that's here. It's definitely different from an outside practice in a very positive way. We're slower with patients, but patients want us to take our time with them. And so again, it's a better feeling of community here. It's a good feeling of family here. And it just fits right.
Like, how would you define your role within the primary care team as the MD?
That changes. I consider it sometimes it's cheerleader, sometimes it's support, sometimes it's just listening. Sometimes it is, saying, okay, here's what the issue is, here's what I think we need to do. But you always need buy-in from the patient. If they say that, I'm not comfortable with that, you find something that works. So it's a shifting role, it's a changing role, which is always challenging, but it's also good, because especially when that patient will meet you somewhere, at that time for what they need, that's very rewarding. And I think it's rewarding on both sides.
Dr. Vialba, could you touch on some of the tools that our providers use to maybe diagnose a patient?
Sure. I mean, there are a lot of them. However, I always think that the most important tool is your ears and your heart. Okay, you got to listen to what the patient's saying, absolutely, without a doubt. And you need to be able to understand what that means and what it means to them, sometimes very quickly, depending on what the situation is. So it's probably the most important thing, what you're thinking what the patient has with what they're telling you.
Well, Dr. Vialba, thank you for all of that. If you don't mind, could you show us some of the equipment you guys use in the exam rooms?
Sure, let's go.
All right, thanks. So Dr. Vialba, we're now back in the exam room, so maybe show us some of the equipment you guys use.
Okay, great. Here we've got a few things. We've got our blood pressure cuff, we've got our otoscope, and of course we'll check a blood pressure when somebody comes in, or the medical assistants will. And we've got the manual one there, we've got the electronic one here. We've got the otoscope, so if we need to check somebody's ears for a problem. We've got the ophthalmoscope, where we get to check somebody's eyes for a problem. Here's for temperature taking and everything. Behind you, we've got a scale back there. Although, sometimes we'll use that, or some patients have a hard time standing, okay? So actually we can weigh them here on the table, or on the exam table. This will go up and down. It'll also take their weight. So we've got multiple ways to weigh anybody.
Well, Dr. Vialba, thank you for your time today. We really appreciate it.
No problem, pleasure.
I'll see you around, sir.
All right, count on it.
So big thanks to our primary care providers for their time and sharing their stories today. And we also want to thank them for their continued services for the community. Remember, you can call our primary care teams today, schedule your appointment, and come in for a visit. So until next time, have a great day.